Okay, let's get going. Hi, everyone. I actually on, there I am. Okay. Hi, everyone. Welcome to the 8th annual training webcast presented by the New York State Department of Health, Office of Mental Health, and Institute for Disaster Mental Health at SUNY New Paltz. I'm Carla Vermeulen, the Deputy Director of IDMH. So today's event is really a follow-up to the webcast that we hosted last December with the same really excellent presenters, Rachel Kaul and Kayla Siviy from the Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response. Ms. Kaul is a licensed clinical social worker and the behavioral health lead for the agency. She has extensive background in providing guidance and direction to the behavioral health, public health, and emergency response communities throughout the country on ways to enhance and integrate behavioral health services into preparedness, response, and recovery efforts in order to foster individual, community, and responder resilience. Ms. Siviy is a behavioral health program analyst for the agency, where she supports behavioral health preparedness, response, and recovery efforts. So her background is in social work, and she has extensive experience in international community development and public health. Both of them have been deeply immersed in the pandemic response from the very beginning, and they've used that experience to really think deeply and creatively about how to support responders throughout this really difficult time for everyone. Their December presentation was full of really valuable practical advice. So if you missed it, we encourage you to find it on the IDMH YouTube channel, or I believe it's also up in the Learning Management System. Today's follow-up presentation, Organizational Resilience and Making Meaning During COVID-19 and Beyond, comes at a time when I think we're really all starting to feel some real optimism about the future, while also recognizing the need to just stay focused on our work through whatever the remaining phases of the response are going to turn out to be. So I'm really excited to hear their guidance on this point. So I will turn it over now to Rachel Kaul and Kayla Siviy. Thanks.
Thanks, Carla, and thank you all for inviting us to engage with you again. It was really a pleasure when we did this in December, and we really wanted to update some information and some strategies that we've been hearing about and present them to you with a focus less on individuals, but more on organizational or team strategies that could be implemented, as well as some leadership strategies for those of you who are in formal or informal leadership roles. And just to sort of give you a little bit more background. My background started as a social worker in hospital healthcare settings and in emergency room social work. And then I moved into the crisis response in the community realm before starting to do disaster behavioral health at the state and then eventually the federal level. So it gives you a little more context about what my background is. I'm going to let Kayla give you a couple more sentences about herself, and then we'll get started.
Thank you, and hello everyone. Thank you all for joining us. My background is also deeply connected with social work, and I have a background in international community development and working with international organizations, various community settings and schools. So that's sort of the lens that I bring to this conversation. And I really just want to dive right into the material. So I'm going to hand over the metaphorical mic back to Rachel.
Thanks, Kayla. So let me just set up some sort of how this is going to work. If you weren't at our last session, generally what we like to do is make this as interactive as this mode will let us. So to do that, we tend to use the chat box. We ask questions and encourage you to use the chat box to answer those questions. So we use it more in a dialogue with us. And also, we'd ask you to hold your content-specific questions until the end. We're going to be very happy to answer questions, but that way we don't get distracted off of the topic that we're on, but we do want to make sure we answer all your questions. We're also going to be off camera during the actual presentation of the slides so that, again, we're not distracted by, I get very distracted by my own face on camera, but we're happy to come back on camera after that. You'll notice throughout the slides that there are hyperlinks during the content that will go directly to additional resources. So we really encourage you at your pace to do that. And I think with that, we'll get started. So just so we understand who's in the room with us, one of the things we wanted to do is launch a poll to kind of find out where your practice setting or work setting is. So Andrew, could you launch that first poll for me, please? So if you look at that setting, which one best describes your setting? And go ahead and answer that. And if you don't see yourself in there, feel free to go ahead and put it into the chat. All right, I'm going to give it 10 more seconds. Go ahead and put the best one for you. And let's go ahead and close that poll and see the results. All right. So Andrew, can you show us the results of that poll? Excellent, thank you so much. So it looks like we have certainly behavioral health environments, public health, some hospital, a little bit of EMS, and I know that some of you are probably in other kinds of practice settings that you shared with us. I know we had some from Project Hope, excellent, and CBO, terrific. So we've got a good mix of people, but a lot of folks in behavioral health settings, as well as public health. Kayla, you want to go? Thanks for, you can go ahead and close that poll out. Thanks, Andrew. Kayla, next slide. So our practice setting is a macro practice setting. We work obviously at the federal government level. So our role is really around coordination of behavioral health information, activities, and resources from the federal level, but with the understanding that, as you all know, the vast majority of behavioral health, and particularly disaster behavioral health activities, take place at the state and local levels by state and local partners. So we just try to really make sure we understand best practices that are happening, amplify those, provide technical assistance when needed, working closely with our partners at SAMHSA, as well as with NGOs such as the American Red Cross. So gives you an idea of, we're at the kind of 30 to 40,000 foot level, if not 60 sometimes. The challenge of that is sometimes we don't always know the details of the ground truth of what's happening. But the benefit of it, and particularly over the last year, is we have access to many, many stakeholders in many, many different kinds of settings. And we've really tried to spend some time finding out from them what they're implementing in their own practice settings, whether it's personal or in their organizations, to kind of manage the adapting that we've had to do because of the COVID environment. Next slide, Kayla. So today we're going to do a few things. One, just very quickly touch on what we did on our first webinar and provide you a link to that. We also want to look at what are the specific challenges that organizations are feeling, the stressors that affect organizations or teams as a whole. We're going to talk about some of the stress conditions that workers are experiencing and describing that show up in the workplace. And then we're going to talk about how organizations can work, or leaders can work, or teams can work together to mitigate those strategies. We have a variety of approaches and things for you to consider, and just, we don't expect all of them to resonate with everybody, but what we hope is when you look through the whole collection that we have found by talking across sectors and all across the nation in the past several months, that you'll find something that might be applicable or valuable for your organization. Next slide.
So really quickly, back in December, we had a webinar that really focused on the individual, looking at stress and strategies to promote well-being in the COVID context. And we looked at the participant evaluations, and what really struck me were the high number of comments on validation of stress that people were feeling, and participants recognizing that they're not alone in those feelings, in the stress and responses to incredibly challenging circumstances. Again, everything blue and underline is hyperlinked, so you can look through this at your own pace if it interests you. And we also have some key tools that we brought up during that conversation. And Rachel, did you want to quickly go through and give a recap of those?
Yeah, we pulled these three to make sure that you all had visibility on this, even if you hadn't been on the first webinar. One of the tools that we have found we had a lot of positive feedback on is a tool we call Behavioral Health PPE. What it really is a plan that responders and workers can do themselves prior to whether it's a crisis event or a disaster response or just a very stressful time to really determine their own strategies for managing stress and things that they can do to optimize those. The Proquil self-assessment tool is a nice self-assessment tool to sort of understand the differences between things like compassion fatigue, which we'll talk about in a little bit, burnout, as well as job satisfaction. And then we also have the CHAMP Optimism Self-Check. This is a nice tool that helps you understand sort of the way in which you approach thinking about challenges and distressing kinds of circumstances, and thinking about how to shift that to be a more problem-solving focus. So these are three tools we have gotten a lot of feedback on that people really value. So we wanted to make sure you had links to that within this presentation as well. Thanks, Kayla. Next slide. So when we were talking about putting content together for this, one of the things that really struck me is we're in a very different place today, sort of towards the end of March than we were in December. And what I have been having conversations with people about is sort of, as we're sort of a year out for a lot of people from this really starting to impact us, there's been a lot of opportunities and desire to sort of reflect on where we've been, understand that sort of what we call that sustained operational engagement, or that sort of stress that you never really are able to completely stand down from it, just because we're all living inside of the pandemic, whether we're at home or at work, kind of puts us where we are. And now we look ahead thinking, where do we want to go? And as Carla said, there's a lot of reasons for feeling optimistic now, and we certainly hear people talking about that. But I also have had a lot of conversations with my colleagues, just really reflecting on some of the challenges and the losses that we've sustained. So our content is going to kind of help us, I think, find good strategies for being able to do that while still setting a positive course forward. Next slide, Kayla. With the caveat that the way forward may not be totally clear right now. And I sort of look at this photo and I think it's not so much that I don't know where I'm going, it's just the path hasn't quite been shown to me. And I like to think of this as the fog is lifting, it just hasn't quite lifted yet. So I want to put that caveat in there. I know we're still kind of trying to figure out where we're going and how we're going to get there. To do that, next slide, Kayla. A lot of agencies and organizations have started to also try to take a pulse on how people are doing now that we're a year out. Kayla, did you want to discuss the data that we found?
Yeah, so this information is from Mental Health America, and they published the Mind the Workplace 2021 report. And I do really recommend scanning through this if it interests you. But what strikes me here is really the high rate and scope of stress within the workplace, and reports of feeling emotionally drained, which can really be a precursor to burnout, which we'll explore a little bit more later on. So even though this information is captured individually, the workplace is made up of individuals, which is part of the reason why we're going through this. And I found it to be a really interesting report. And in another survey by the American Psychological Association, they found that 1/4 of essential workers have been diagnosed with mental health disorders since the start of the pandemic. And even if we look more broadly, the report found that essential workers have experienced an increase in undesired weight changes, changes in sleep habits, and almost 40% reported drinking more as a coping method. So the survey really captures individual experiences, but the reason we bring them up is because organizations are, again, made up of people. And there are these themes and mental and behavioral health experiences occurring within the workplace as a whole. And that's what we're going to be exploring and talking more about. before I move on, Rachel, is there anything that resonates here for you?
No, I just think it's important that we consider the fact that our organizations are our people, as Kayla said, and that's something, a message we've been really trying to promote within our agency is we have a very important mission, obviously at ASPR, at HHS, but at this point, everybody's been so focused on the mission that I think it's time for those of us who are in positions of influence or authority or leadership to be able to really focus on our people to make sure that they're able to continue to sustain the mission. Thanks, Kayla.
So one of the common threads that really came up in both of these surveys was an increase in stress. And individually, we've looked at this before. Stress is a response to a stressor. What we're hearing now through stakeholder engagement is that there's a broader experience of stress within the workplace. And this is echoed by the surveys and data that's coming out. So organizational stress, as opposed to individual stress, is really the results of stressors that are challenging to the whole workforce as a collective and broader experience. And in talking with people across sectors and various stakeholder groups, we really pulled together some of the organizational stressors that we've been hearing and categorized them into these columns or buckets. So I'd like you to take a moment and look through these organizational stressors and think about which categories resonate within your own organization and your own work setting. So perhaps are there personnel stressors like workforce, employees experiencing heightened obligations and increased uncertainty? Or maybe there are safety concerns for employees or demands on staff. So I'd like you to kind of look through and see what resonates and put those numbers into the chat box. And Rachel, I'm not sure if it's really resonating with you right now.
I certainly think understanding, even with vaccines and great things happening, the same risk of exposing high risk employees, that really resonates with me. That's a big stressor for us in sort of determining how are we going to get back to work, back to the office. Are we even going to do it, given if we can do our functions another way? I also look at, from our realm, the changing guidance that continues to change, continues to be updated. It's necessary. It's a necessary piece of the pandemic, but it puts an inordinate amount of stress on organizations that have regulations or processes or procedures that they're trying to maintain. I'm seeing a lot of folks talking about number two, sort of those workplace stressors, the mission creep, the new challenging expectations. Anything else, folks? Yeah, 2 and 5, okay, procedures and processes. And the same prolonged stress and uncertainty, the unclear changing guidance. Again, that really resonates with me. It looks like workplace is really, for this crowd, really resonating. And part of that may be, I'm also imagining there may be budgetary challenges as well, financial concerns related to reimbursement, changes in reimbursement or access to clients and that kind of thing. And some people are putting in, yes, even more than that, 1, 2, 3, and 4. So it sounds like as you look at these, you start to really see that your organization is certainly experiencing stressors that probably the entire workforce is having to pivot, change their skills, or update or enhance kind of how they approach their work in order to meet the mission. Kayla, anything else on this one?
I'm just a little curious if there are any additional examples that maybe aren't covered here that immediately come to mind as organizational stressors for you in your workplace.
I can give one while people are typing, but certainly where we sit, the change in leadership across government is an organizational stressor, right? I mean, every single agency is getting new leadership, and that means changing and shifting priorities. So So that is certainly a stressor that I think is happening. And it looks like Carla was saying, make sure when you're doing the chat that you're chatting to everyone, so that Kayla and I can see you too. That would be great. Thanks. Next slide, Kayla.
Okay, so with a Y for yes or N for no, is this familiar to you? Have you seen this continuum of stress? You can just put that into the chat box. Okay, I'm seeing some yeses. This continuum may look familiar, and if so, you've probably looked at it as an individual assessment tool. But this can also be used as a tool to assess your organization, which is how we're going to frame this. The continuum of stress looks at how stress impacts performance. So within your organization or workplace, do you find your organization to be maybe in the ready or reacting stage, where stress is improving overall workforce performance? Maybe you find your organization in the injured or ill stage. There may be conflict among staff, collective distress, and a need for concrete strategies and intentional approaches. So reflecting on that, Andrew, can we launch the next poll, please? So right now, where would you put your organization? So not just looking individually, but your organization and workplace as a whole.
And while you guys are answering, I know that some of you have mentioned that you don't have an option to chat to everyone, but I do think you have an option to chat to all panelists, and we do see that. So if you want to, when we're asking a chat box question, if you want to try to all panelists, and if we're still struggling with that, we'll shift to Q&A, because we're nothing if not flexible. So no worries on that. And let's just give it another couple of minutes, and then a couple of seconds, I mean, and then we'll close the poll. All right, can we see the results of the poll? See where you guys are finding yourselves. All right. So that's good. That's interesting. A lot of people are feeling like, hey, we're certainly experiencing some stressors and some stress, but we're kind of ready and reacting. We're feeling pretty good. And a few are putting us over into the orange and injured, which is certainly not where we want to be, but is understandable given depending on your context and sort of what you've been managing in the last several months. Kayla, did you have reflections on this as well?
I think similarly, yeah, it's really interesting because we pose this question in this poll pretty frequently, and I do really enjoy seeing it kind of move closer to that middle ground of reacting or verging into the orange and the injured stage. That's kind of where I'm at in my reflecting of this.
Thank you, Andrew. Kayla, next slide. So just to kind of ground us in some terms and sort of in kind of what we're going to be thinking about here, when I think about the word I hear the most right now is burnout. It's what people are worried about. It's what they're talking about. When I think about it from an organizational perspective, I sort of think, well, what does that look like? What does organizational burnout look like? And it doesn't mean that everybody's behaving this way, but it means there's significant numbers or teams behaving or exhibiting some kind of challenge to their performance that starts looking like, you know, more mistakes are being made. Certainly group interdynamics, this will show up, more gossip, more rumor spreading. Those are the kinds of behaviors that indicate that you may have staff burnout going on. And obviously things like absenteeism and turnover, right? That's an obvious sign of organizational burnout. The other side of that that's concerning is that can result in decreased performance and decreased customer care, which is certainly not what anybody wants to see. So addressing organizational burnout, if you're worried about it happening, or if you're already feeling like you're heading into those ill and injured zones, it's really important to take a pause and decide what you're going to want to change in order to address that. Next slide. So what we're going to spend a couple minutes doing is sort of looking at the conditions that we are hearing workers are saying that are concerning and struggling, that they're struggling with a little bit, and then talk about how to address them after that. And you'll notice we sort of said we were hearing a lot about compassion fatigue early on, and now we're hearing more about burnout in general. And then kind of the new thing we're hearing about is that sense of grief and loss, whether it's a human loss or just the loss of kind of things as we used to do, things we used to know, things we used to enjoy, which shifts over into complex grief in some cases. And then I want to talk a little bit about collective grief as well. Next slide. So compassion fatigue, if you've been to our individual presentation, it shows up particularly in care settings where your people are being exposed to other people's suffering for prolonged periods of time, or maybe the intensity of the suffering or the trauma that the provider or workers being exposed to can injure the actual provider as well. Most people exhibit this by becoming more detached, by displaying less empathy, and that can be very concerning, particularly in healthcare settings, behavioral healthcare settings, or social service settings. Also, the other way this will show up among staff are people that are, and leaders, managers, teams that are just having a hard time standing down. We've been going at a sprint for several months, and people are still finding it hard to find ways to practice self-care, take time off, set appropriate boundaries. So compassion fatigue is still definitely a concern. Next slide. But it blurs more now with burnout, which is really about just the exhaustion of the pace, or even just the exposure of the kind of context of COVID and all of the problems and uncertainties that entails. The Employee Benefit News, which is an EAP newsletter that goes out to quite a few people, did a survey asking workers kind of what they would attribute the cause of their burnout to. And what was interesting is obviously about 25% said, well, it's an unmanageable workload, right? And you'd expect that. But what surprised me a little bit was another 25% really attributed what was contributing to burnout for them was a perceived lack of support from leadership, and also a lack of burnout recognition. So just failing to even address or acknowledge burnout, and then try and figure out how to support the workforce is actually contributing to employees feeling burned out. And it's not just direct caregivers, by the way, depending on your setting. It's also support staff, admin staff, house cleaning staff, drivers, transportation. There's workers in very different roles that, based on the nature of the work we've had to do and the way we've had to change how we work, that are also expressing burnout. Next slide. So the other thing I've been hearing a lot from colleagues and then stakeholder calls in the last couple months was a sense that, sometimes they just feel like they're all over the place emotionally. They get up and they're on a short fuse, or they're feeling kind of hopeless in spite of the fact that, look, we're getting vaccinated, things seem to be working, and they're kind of confused about that. And the Harvard Business Review published an article a couple of weeks ago, and I just really, it was a bell kind of went off for me, like its title saying, that discomfort you're feeling, it's grief. And that was an aha moment for me, particularly when I understood and sort of thought back to kind of those stages of grief. Let me just ask really quickly in the chat box, yes or no. Those 5 stages of grief that are basically developed by Elizabeth Kubler-Ross and were sort of taken from her 5 stages of dying, and she transformed them worked them into the 5 stages of grief. Are those familiar, yes or no, for people? Let's see. Okay, yep. Okay, this is a very savvy group on grief, so I don't have to tell you then. But just to frame the issue is to remind people, one, it's that what we've experienced, in spite of the hope ahead, is it's normal to have feelings of grief, and these emotions are normal emotions, right? The graphic here shows a lot of people think about it as a linear path from denial through anger, bargaining, depression to acceptance. But we know, those of us who work in behavioral health or who've experienced this, that it's not like that. Grief is much more like the graphic on the right, where you're bouncing around between these emotions, and you can get to a place where you feel like you've reached some stage of acceptance, and then something will trigger another period of sadness or anger or just a feeling of disbelief in the losses. So just to kind of frame that, these emotions are working through people right now, which is going to affect their interactions and their ability to function in the workplace. Next slide. So the other complicating factor for this is that we've been disenfranchised from the ways in which we're usually able to process grief, right? We've been unable to do rituals. We've been unable to do memorials. We've been unable to even, many of us, take a breath and just acknowledge what the losses have been and reflect on those and honor those. And when you have a disenfranchised form of grieving, you are at much higher risk for complex grief. So Kayla, you want to talk a little bit about this?
Sure. So complex or complicated grief is that ongoing, chronic, and impairing form of grief. And I really like focusing in on the image on the right, because it reminds me that grief is not contained to an individual experience. Individual presentations of grief have an organizational reach in how they impact the dynamics and performance within the workplace and within an organizational setting. So we can use a workforce grief assessment within teams and organizations to really assess some of the ways that grief is impacting the workforce and what that looks like. So mood swings can create workplace conflict. Physical presentations like exhaustion can show up in absenteeism. Behaviors like distraction and thinking, like difficulty concentrating, can become consistent. Staff mistakes with regular tasks and responsibilities. So these are spaces where grief can show up in the workplace. And Andrew, if we can put up the next poll, please. I'd like you to go through those and kind of think about your own organization and your own workplace. And do you notice any of these presentations showing up within your organization? Maybe none of them are, but try and identify and really assess within your organization where they might have come up or examples of that.
And I know when we talk to our colleagues, as we've been having these conversations, in our organization, a lot of it does fall into either sort of the feelings. People are much more willing to talk about a range of emotions that kind of surprise them even at work, or in the physical, just people are finding they're getting sick with, minor head colds, or they're not feeling well, they're experiencing more body ache kind of stuff. So we're really seeing folks talking about it, and if they can link that and put words to it, it can help them kind of decide what to do about it. So helping people articulate how grief is showing up and thinking about that from a workforce perspective can be really useful. Want to go ahead and close the poll? And we'll look at the results. Just taking a minute for that.
In the meantime, I really appreciate that one of you brought up that you're seeing all of these within your workplace. Sometimes it's not one; it can be a collection of presentations.
And the other point I would make is it may be something you haven't really thought about before. Like, gee, when I think about how are my colleagues and my team behaving, how am I feeling? How's this showing up? So it maybe you haven't really thought about this, but it's something useful to kind of reflect on so that you can help identify what might support people, what might help them through it. Thanks, Andrew, for doing that. Next slide. So the other issue that we're, I'm sure, all aware of is a sense of collective grief. Like everybody is experiencing some sense of loss, and many of us have lost people in our lives, colleagues, friends, loved ones, maybe not even due to COVID, maybe because of COVID, but many of us have suffered loss, but that ability to grieve the way, in a ritualistic way, the way we want to by gathering, has been denied us. But even if we haven't had human losses, we've certainly lost our sense of, safety in our environments, our sense of routine, normalcy, the way we maybe are most comfortable doing our work or going about our day. So knowing that everybody is sort of experiencing this loss and walking around with it, there's this collective grief. And the downside of that can make people feel a little hesitant about reaching out for help themselves or for support from others, because they know everybody's sort of experiencing hard things or has, and they don't want to be a further burden. But the positive end of this is because there's this collective grief, it's actually something that we can talk about. It's something that we could approach and mention, and it's not quite so uncomfortable, because we know that people are in maybe not the exact same boat we're in, but they're in a similar boat, and we can use this as an opportunity to feel more connected. Next slide. So that kind of framing the concerns and the issues and the conditions that are affecting people as individuals, and then they bring that into their team and their work and their organizations. What can we do about it? So we're going to go through some strategies, not just strategies we've read about, but actually strategies that we've gone out and polled different kinds of organizations to see what they've actually implemented, what they've actually been able to do, or what they found most useful. So we're going to do a variety of strategies and see kind of if hopefully some of these resonate with you or inspire you to make some additions to how you approach work and your organization. Next slide. So just thinking, again, linking to kind of the conditions we talked about, with compassion, fatigue, and burnout kind of mixed up together in a lot of our environments. One thing we really encourage is intentionally sort of developing an organizational awareness of kind of what is happening in the workforce, what they've successfully adapted to in terms of their work, in terms of their own self-care, as well as what the challenges remain. Understanding there's certain collective and individual characteristics in the organization. The other thing to remember is if you kind of take the pulse of your workforce, you may find many of them will express or seem a little more detached or say a little more disconnected, which is actually an adaptive coping mechanism in certain circumstances. But we point it out because it's one thing to sort of in a self-protective way and in a way to compartmentalize and stay functional at your job, to disconnect a little bit from the emotion, the empathy, to be able to function, particularly when you're faced with high levels of distress and distressing circumstances. But it is a challenge if folks have been leaning on that coping mechanism for too long, and now it's actually creating a service system or an environment where people are disconnected from either one another as team members, as colleagues, or from the folks who they serve or work for. So it's a good idea to sort of try and take a pulse on this. A couple of the folks we talked to had used a strategy. One had identified someone to serve as a resilience officer, whose job is to, on a regular basis, kind of have these conversations, informal conversations with staff members and team members, and sort of identify what they were seeing in terms of themes around how people were coping and feeling and what they were doing in their work. Another organization, which is a large hospital system, developed an interdisciplinary committee that focuses, it includes healthcare professionals, it includes administrative staff, it includes all kinds of voices to talk about what the effects of stress and the workload and the demands on them, what effects that was having on their workforce, and then coming up with realistic strategies that could be implemented and that had leadership buy-in, because this advisory committee had come up with them. So these are kind of some different things that you could consider implementing just to do that kind of organizational assessment of how are things going. Next slide. In other words, it's kind of taking a look at, if I look at my team or my organization, the first thing I might want to do when I'm assessing things is saying, what have we stopped doing that we used to do that was an important part of organizational resilience, a team cohesion, a team support? So what are the things we've had to stop doing? And we just filled in a couple of examples here, clearly having in-person meetings or gatherings, maybe for some places having a consistent schedule and time off, these kinds of things that you've had to stop doing. First, kind of take a reflection on that. As we go through this, we'll also looking at some of the things that maybe you've started to do or adapted because of the COVID situation that you want to continue doing, even as things kind of return to the way we're used to business working, we're used to doing practice. So what are some things that you're saying, hey, we've started doing this, and I really think this is a good thing, I want to continue that? And then what are some things you might want to start doing, some new strategies, or even maybe getting back to some of those old strategies that you had to stop in the first place? Kayla, did you have any reflection on this?
This really makes me think about our workplace setting and how we used to always go on breaks and go outside for just a couple minutes, and there was this normalcy in that behavior, and that's definitely something that has stopped during the pandemic. We still remind each other to go outside, but the camaraderie around being able to go around the block with colleagues has stopped.
Our around the block moments, I'd call them. And just for clarity, Kayla and I work in a building with no windows. So it was really necessary for me and my team and others of my colleagues to sort of say, okay, it's time for us to get some sunshine and just fresh air, 5 minutes, 10 minutes. So that was a really important thing. And it is, it's something we've really given up, that shared sense of experience of taking that break and looking out for one another. Next slide, Kayla.
So another strategy for burnout is pacing. And this information was provided by Dr. April Naturel, who is with our technical center at Asper, but also works as a consultant in a variety of settings, including healthcare and hospice. And pacing programs are a set of recommendations that help pace schedules and increase flexible time. So with this approach, organizations, teams, and leadership can choose which strategies work within their own setting and adapt them. So we've included some leadership considerations as well to keep in mind in integrating best practices into organizational policy and modeling behavior. And this can be as simple as changing 60 minutes meetings to 45 or 50 minutes, and really integrating breaks and time, even if it's 10 minutes, so that there's space to take a comfort break, in all honesty, before your next meeting, and just taking these small changes and these small adaptations to structuring your workday in an intentional way. So before I move on, Rachel, is there anything you'd like to reflect?
Yeah, when I was talking to April about this, she mentioned two things that I thought were really important as well, is really thinking about projects and work output and deadlines that get attached to those, and really thinking about those deadlines. Are those real deadlines, or are they sort of imaginary deadlines? If you know what I mean, does this really need to be done by Friday, or could we give people until Wednesday, and it would not actually change what we're trying to accomplish with it? So just really taking a look at the workload, the expectations, and asking the question, is this expectation going to be supportive and prevent burnout and address the fatigue that many of my staff are feeling, or is it going to contribute to it? And the big piece of this is really the leadership piece. It has to be it has to be bought into by leadership, and leadership really needs to role model it, as Kayla said. And I don't just mean formal leaders with responsibility. I also mean sort of the informal leaders, the folks in the office or the workplace, the organization that people look to emulate. So this is an interesting approach that actually has yielded pretty quick results where it's been implemented with folks that April has worked with. Next slide, Kayla. So thinking about compassion, fatigue, and burnout, again, one of the strategies I certainly try to encourage for individuals is adaptive engaging. And just again, really quickly with a Y or an N in the chat box, is adaptive engagement a familiar term or not really? And it's fine if it isn't, but I'm just curious as to whether this is an approach that people are very familiar with. Okay, so I'm seeing there's enough for me to kind of explain this just really quickly. When I'm talking about adaptive engagement as kind of a cognitive skill, it means intentionally kind of taking a look at who you engage with and how you engage, right? So there are people that we engage with professionally and also in our personal lives that take energy from us, and there's people that give us energy. I'm sure we've all run across the coworker who just has a more, for whatever reason, a more negative attitude or a more is less of a problem solver and more of a problem identifier. And those people can actually, you know, the more time you spend with them, the more that can shift the way you're cognitively approaching things. So it's helpful to sort of understand, how am I approaching people? Am I approaching people with dignity, civility? Am I avoiding toxic conversations? Though I can't completely not engage with people that I find a bit draining, how can I make sure that on balance, I try and make sure I fill my bucket up with people who do give me energy or who do inspire me? So that's adaptive engagement. It can really help with some of the effects that we see from compassion, fatigue, and burnout. From an organizational standpoint, you can encourage adaptive engaging by really thinking about how you are helping or facilitating your staff and your colleagues to interact. You know, having virtual social events. You know, we used to do, I'm sure when we were all in the office, we do birthday parties, you know, once a month, maybe for everybody who's having a birthday, or go out to lunch together, but maybe having a virtual meeting that's not work focused, but really focused on just people getting to see each other and talk about what they've been up to, something fun that they've done. Also making sure that workers, even if they're not working on site, or not in sort of team lead positions, that they have input on decisions that are being made as we look at continuing to adapt our workplaces and our practice. Pairing positive and seasoned people with people that maybe are less seasoned coming in. You know, I know in our agency we've had several people who've had to start working in a virtual environment, you know, with really very little opportunity to have a large colleague base from which to sort of understand the culture. So trying to make sure we intentionally put those people with mentors, and then thinking about, are there ways that the organization can help support the needs of families, the tangible needs that come from that family side, whether it's driving into the office when that's necessary by providing parking or transportation sharing. Is it having Friday pizza for everybody so that there's food available, or snacks, or maybe coming up with a collaborative system where people can assist one another with things like childcare or pet care, if and when that's appropriate, and people can do that in a socially, in a safe way from public health perspectives. But these are things that really can help form that adaptive engagement, that sense that people are working to support one another. And then, you know, Kayla and I are always big fans of the buddy system. We bring it up a lot. and instituting a formal buddy system can really, and a structured buddy system can kind of take the kind of informal peer support that we tend to see to another level. And the link there to the CDC gives some examples on how to do that. Kayla, did you have anything else on that one?
Nothing else from me. Thank you.
Terrific. So next slide. So when we're talking about grief, and this is what I really wanted to spend a little bit of time on, is going back to those five stages of grief. You know, recently I've been doing a lot of reading of David Kessler's work, who was a colleague of Elizabeth Kubler-Ross, and he's developed the sixth stage of grief, which I find pretty compelling. The idea, in his experience, he had a very substantial personal loss, and realized that sort of many people, including himself, had thought, you know, we're trying to get to acceptance of a loss. But he realized that acceptance is not an end state, really. It's not enough. So what he ended up working through was the sixth stage of grief, which is really, how do we find meaning or make meaning in spite of, or even because of, the losses we've sustained. And even when that's hard to do, and you know, it's certainly, and maybe it's not a permanent end state, but really working towards those moments where you find meaning, the small ones, or even maybe larger ones, where the loss has really given you a different direction or a meaning that you, a sense of purpose that you didn't have before. So Kayla?
Yep, so we actually decided to reframe our question last minute. As Rachel was saying, I'd like you to think, in spite of, or maybe even because of the losses we've experienced, what are some of the positives, some of the gains or meaning that you can point to or identify within your own organization? And I'd like you to kind of reflect on that, and feel free to put any of your answers into the chat box. Stronger bonds, as someone noted. Definitely.
I know from my, as you're typing, as folks are typing, you know, my behavioral health team, we've been able to reach now thousands of people to talk about coping and resilience. And I feel really grateful for that, because people are willing to do this on a virtual platform, and they want to know, and they want to talk about it, and they want to share it. And that has been really meaningful to me. Yeah, more awareness of mental health.
And appreciating the small gains, and additional support and better the big picture. These are fantastic. Thank you all for these responses. I do want to be conscious of the time. So I think we're going to move on to the next slide, unless Rachel, you have any additional reflections.
No, but I do think a lot of people have a theme of sort of feeling like they're more genuinely connected to people, they've bonded stronger, they're connected at work, feeling like they've been going through something. I really appreciate that as well. And we've been hearing that from my colleagues as well. And I've also heard a lot of people saying, look, I've really reprioritized some things. And people who would have turned themselves, you know, workaholics and type A's are really starting to think about how to create more balance, which I think is a benefit to all of us. Next slide. So, and again, some of the guiding questions, if maybe you're having trouble even thinking about, or, you know, how to find the meaning, how do you even identify it? And there are just some guiding questions to sort of help, just thinking about the opportunities. I was also thinking, just in terms of skills, like how much better many of us are having had to learn how to do virtual meetings, telehealth, you know, imparting information and having conversations without being face to face, and doing it in a way that is actually useful. So I think those are skills that we've really also developed as well, and some opportunities. Next slide. So the concept of grief leadership is something we really want to touch on, because it's a really important element of helping organizations who may be on, nearing that, if you think back to the stress continuum, the injured or ill side. And it's also just a way of understanding how we lead and guide at this time when, so many people are experiencing loss. Kayla, do you want to go into this a little bit?
Sure. So this content is actually pulled from the Center for the Study of Traumatic Stress. And the key pieces I gather from this is really acknowledging grief responses as they happen and creating space and time for those responses within staff, as well as using a varied and intentional communication approach. So recognizing when maybe your staff may be overwhelmed, or employees just aren't in a space where they want back-to-back emails or back-to-back Zoom calls. So being really intentional about the communication taking place and adapting based on feedback.
And in terms of cultivating a sense of organizational meaning, I think taking opportunities as a group, as a team, as colleagues, to reflect on kind of what the last year has been like. I know a lot of you have been doing that in the chat box and telling us how working together, leaning on each other, supporting each other, trusting each other has been really important. And then also maybe take some time to think about where do you want to go as an organization. Break that down into a feasible goal, but think about, we are on this path. Think back to my slide with the journey. We're on a journey. We're in the middle of it. We're not at the end of it. And as I said, we're not quite sure where we're going to end up, but this is a good time to reflect with one another and to decide how you want to guide the organization in the direction you want it to go. So I really encourage those kinds of conversations, and they don't have to be hour-long, deep dive, emotional sort of conversations, though if that is useful, that could happen too. But they can be shorter sections of staff meetings or calls to just sort of reflect on a couple of these things and really think about collectively where folks want to go. Next slide. And back to my team assessment. So again, just going to put this back in context. You think, okay, what did we have to stop doing that was kind of important to us or that we enjoyed? But what are the things we've started doing that we'd sort of like to continue doing? I mean, for us, my team, every morning we check in with each other for 15 minutes on Zoom. And that certainly was not the case at the office, but every morning we sort of set the table for the day. And that stand-up also includes just a check-in of how we're doing, how are you doing? How are the kids doing? How are the dogs doing? Like a small check-in that's both personal and professional. Like that's something, no matter how our work practice changes as we consider reentry back to office work or not, because I want to continue doing things like that. Kayla, I know you wanted to reflect on this too.
No, I would just like to echo the practices that we've been able to pool into our own team with the morning huddle, and just being able to very quickly go through and see what's on everybody's plate and where's there space to support each other as a group and as a team, and normalizing that as a daily routine.
Yeah, I know there's a comment. I mean, that awareness of work-life balance, I think just the nature of the pandemic with people having to school their kids and take care of elders and do all this, I think there's more awareness now that we do need to know how people's needs at home can successfully intersect with their needs at work, and we don't have to ask people to sacrifice one for the other. I think that has been a very valuable lesson for a lot of folks, and one that I certainly share. Next slide. So another strategy that I'm I've used in the past and I know is extremely effective is sort of strategies to look at how to build team cohesion. And the CHAMP program, which is part of the university USIS, University Services of the Uniform Health Services, USIS, the CHAMP program, and the link is to the bottom down there, on how you can build trust. And the impetus of this program is that in order for teams to truly engage and be cohesive, that is built on trust. And trust is built on a foundation of these 4 elements, right? So dependability, physical trust, emotional trust, and team trust. And their perspective is if any 1 or 2 of those things are not strong or are not present, then it's very difficult to actually support team trust, right? And by dependability, meaning, can I rely on my team members? Do I know what to expect from them? Do they know what to expect from me? Physical trust, being, physically comfortable with people, and particularly in the time of COVID, that could mean, are they practicing appropriate public health behaviors, even when we're in the same place? Are they willing to protect themselves and you from infection or illness or injury? Emotional trust. Do I feel like when I need to express something that is a feeling or a need, that's not going to be used against me, and that people will actually respect that and help me? And last, of course, that team trust. Are we pulling in the same direction? Or are there people on the team that really are kind of mostly out for themselves? So there are absolutely leadership and organizational strategies that can help promote behaviors in each of these domains that will then facilitate an overall team cohesion and team trust. And those strategies are more outlined when you go to the website of How Teams Build Trust. And yes, you will get a PDF copy of the slides if you haven't already. I saw that question pop up in the chat box, and you will absolutely have a copy of the slides with all the links. Next slide. So now another more concrete, practical strategy to consider, Kayla.
Yeah, so this is a check-in group model of crisis support, and I really like this because it's quick in the sense that it's an end-of-day huddle of less than 10 minutes, but it's really intentional about how to approach it. So for this model, it's bi-weekly with trained facilitators, and it pulls together a small number of members who are coming at it from like a similar level, so similar roles or ranks, and using guiding questions to really identify difficulties, but focusing primarily on aspects that went well and spaces for how you can take care of yourself and the people around you, and really building that team cohesion. So if you're interested, again, we've embedded the article and the resource, and I really enjoy it. I highly recommend looking into it. Rachel, is there anything you'd like to add?
Just that it also promotes kind of a growth model approach to team members learning from one another on a regular basis and sort of intentionally, kind of what's working well. And then you bring this sort of culture into your team of growth and expanding your abilities.
Fantastic. Right. So we're also going to quickly go over the buddy system, and with yes or no in the chat box, is this a strategy that your organization or you personally already use? Mostly just I'm curious. Okay, so I'm seeing but a fair number of no's within the chat and the Q&A. So a formal peer support through a buddy system is a strategy that I would highly encourage, but it's also a strategy that you can build on and integrate with leadership buy-in. And this can happen through so you can also build on this buddy system through peer support and topic-driven support groups through weekly and bi-weekly conversations, and really including mental health specialists and check-ins for more formal support and guidance. And Rachel, is there something you'd like to add?
Yeah, just that, in terms of how do you implement this or what can it look like, it doesn't have to be terribly hard to implement if people want to do it. And the CDC's guidance that we sent the link on the last slide can help with that. But also you'll notice we've got our link to our behavioral health PPE again, because that was the kind of self-plan, the responder self-care plan that I mentioned earlier and that we highlighted in a previous presentation. But within that behavioral health PPE, it encourages the identification of an actual buddy, a person that you and that other person have agreed that they're going to be your buddy, and you know how to contact them and you're going to contact them. I think a buddy system works best when there's an understanding of regular contact, even if it's just short check-ins. How are you doing? And again, if your organization doesn't do it, you can do it as part of a team or just as part of a cadre of colleagues. We certainly do that at my agency, and I have two buddies. One who's a mental health professional, so can help me chew through some of the issues I'm having or concerns I'm having, and one who is completely not, but understands the agency and the stressors that we work at. And we check in every single week, and it's been hugely helpful over the last year. Thanks, Kayla.
Yeah, well, Rachel, I think you have a really great point on the different layers of the buddy system and how it can sort of show up both within smaller groups and within an organization, and how this can really impact workforce culture and building that growth mentality, which Rachel brought up earlier. So yeah, I think I think this is a strategy that, one, I really encourage you look into, but also be flexible about how it might fit within your own organization and what that might look like.
So just to kind of finish with this segment, looking at kind of some wrap up, some other strategies, we heard from a lot of folks, depending on the environment where it's appropriate, that embedding mental health support, maybe not every day, but on sort of making embedded mental health support available was an important component for managing particularly organizations that were under duress, were feeling injured or ill. That resilience officer is another kind of approach to that. Knowing that resources available to staff, one should also, it's a good idea to consider what's needed for families. And again, we've linked to the Uniformed Services University Center for Study of Traumatic Stress. They have some guidance and tips on how you effectively do that. Obviously, thinking that people's support takes place in a bunch of domains, including spiritual, mental, social, physical. In the survey I mentioned about burnout, one of the things that employees really mentioned that helped them with burnout was access to physical activity from an organizational perspective. So whether that was being given half an hour a day to be allowed to go get some physical activity, or some larger organizations joined virtual fitness programs that they then gave their employees access to. And that was considered a really effective and, quite frankly, cost-effective way of addressing burnout from the perspective of employees themselves. I also want to just point out here that the Enhancing Psychological Sustainment and Promoting Resilience in Healthcare Workers During COVID-19 and Beyond is a brand new article written by our colleagues Joshua Morgenstein and Brian Flynn. And it has a lot of the strategies that we just talked about and some additional considerations for how they could be implemented. It's focused on a healthcare setting, absolutely, but I think it's really, their suggestions are completely, you can extrapolate them to the environment you're in. But that's something you can go back and reflect on a little deeper in some of the topics that we've covered so far. Kayla, did you have anything to add?
No, I think you very comprehensively went over additional support strategies.
So just to finish, next slide, our kind of team assessment activity. So, we identified the things we stopped. We said, hey, but what have we started to do and adapted and incorporated now that we want to continue doing, particularly if we have to re-enter sort of a usual way of doing business, but even if we don't. And then maybe what are some of the things when you reflect on it that you want to start doing? And as I said before, maybe one of those things is something you used to do that you had to stop, but now circumstances are going to make it possible for you to have in-person meetings again, depending on your organization and the status of people's vaccination and health and risk. But, I think for us, we're certainly looking at considering pacing approaches, as well as looking at our organizational policies around encouraging and really promoting people to take leave and to take some breaks, because they haven't been in the last year, and we're seeing the strain of that. So these are things that we're really looking at starting to do. But one of the things, next slide, that we were kind of excited about that we recently started to do is our Hump Day Resilience Tip of the Week. And this came to us, and we wanted to share this with you because we also want you to know that when you're thinking about organizational strategies, they don't have to be big ticket, huge policy procedure items. They can be small, meaningful things that make a difference, but in a more direct, compact way. The Medical Reserve Corps approached us, leaders from the Medical Reserve Corps, which has 90,000 volunteers across the country. And the leaders were really concerned and said, can you help us figure out ways of really helping our volunteers? Because we feel like a lot of them are really pushed beyond the limit. And when we suggested things like, well, we've got a webinar, we have this guidance, we have that, we got a resounding pushback by the leaders saying nobody can consume another thing. Like, nobody's got 90 minutes, nobody can read 2 pages. Like, isn't there something else we could do? And it's funny because Kayla and I and the rest of the team got together and I said, why don't we just do a Hump Day Tip of the Week? Like, on Wednesday, we'll send out a concrete, short, actionable strategy, and make it kind of fun. And you'll notice the picture of the camel up there. That took a lot of time for us to decide on the correct camel, and I give Kayla a lot of credit for that. That took almost as much time as writing the tips of the week has, but we sort of brand it that way. This is our Hump Day Tip of the Week. We've done one on highlighting the disaster distress line and making sure volunteers understand that it's not just for survivors of disasters, that they work in their communities and as responders and volunteers, that if they have needs, they can call and use the disaster distress line themselves. We did one on a really easy way to do a centering mindfulness exercise without having to commit to 10 or 20 minutes of guided meditation, to something much kind of faster and more concrete. We, of course, did one on the buddy system, because if you haven't guessed, Kayla and I are big fans of the buddy system. And our most recent one, which we like a lot, is sort of introducing the notion of rumination, and introducing the research that shows that spending time in nature can actually decrease those anxious, racing thoughts, negative thoughts. So we link to the actual studies, and then we also link to a tool that will help folks identify green spaces near them where they can go spend some time outside, maybe be inspired to do so because they didn't know these parks or these areas existed. So this is just an example. I thought Kayla had a really good idea about making sure that she included strategies for people who may suffer allergies, and how can you bring nature inside. So this is a really fun thing that we've been doing, and we're making it available to thousands of volunteers, and we're getting a huge positive response to this. And it's really easy. This does not take a lot of time for us to do, but it's making a big impact for people and really making people feel like we as a program care about the volunteers that are out there in the community. Kayla, did you have anything else to add to this one?
Well, my office is slowly getting more and more houseplants as I bring nature inside. But I really like kind of taking this tip of the week and creating really short, easy strategies that are digestible when there's just so much information and it can be really easy to be overwhelmed. So finding those small tweaks, those small changes to help teams and organizations.
And if anyone has awesome ideas about what we should include as a resilience tip of the week, feel free to contact us at our email after this, because we got to keep doing this, and it's starting. We're gonna have to. I think eventually we're gonna start stretching a little bit, but right now we're still in good shape. But I'd love to hear other people's ideas too. Next slide. So I kind of want to come back around to this idea that organizations are their people, right? So these organizational strategies, we hear a lot of pushback because people don't have the time, or they don't have the budget, or they don't have the bandwidth. But if you think back to that stress continuum, if your organization is sliding into that injured ill, then to me, it's not really a choice if you want to maintain the ability of your organization to provide excellent services and to take care of your employees. But also, I think we all need to understand ourselves as the things that make up those organizations as well. And so we sort of have to understand where we ourselves fit into these organizational strategies and what we need to commit to as members of the organization. So this graphic we adapted from one you may have seen. We certainly used it in our last presentation, but it's also been on the internet. It was called "Who Do I Want to Be During COVID-19?" And it was really about identifying these different zones that people would find themselves in, and sort of how they wanted to be in a growth zone in terms of how they were adapting and managing the stressors associated with COVID-19. We adapted this to sort of think, who do I want to be in my agency? And the zones we were thinking of is, often we're in reactive mode. We have to be because of the demands on us or the expectations and the resources we have, and we're sort of reacting. Some of that can be functional, but some of it can also create more discontent within the agency. And we often find people who remain reactionary are quick to spread rumors or misinformation. They make decisions without getting input from others. They're not communicating very effectively. It's not a great zone to be in. I'm sure we've all been there before, but it's one you kind of want to get out of. The burnout zone, as things go on, is sort of, I think, when we're saying I'm just not finding myself compelled to and excited by going to work. I'm kind of avoiding tasks that I don't like to do. I really find I'm sort of always looking at the dark side of the situation and sort of consuming negative news about things, and I worry about things that I can't control, and that's kind of the burnout zone. And when you recognize that's your thinking and behaving, it's not a good place to be either. And I'd like to think where we want to get to is that contributing zone. And so to do that, you have to think about, how do I contribute to making my organization healthy? Well, how do I contribute to my colleagues' well-being, my clients or the people I serve, their well-being? And so really looking for ways to adapt, looking for ways to be inclusive and supportive. Obviously taking care of oneself is important as well. But moving towards that. And again, just like with the who do I want to be with COVID, I think it's unrealistic to think that you end up in the contributing zone and you stay there forever. I think circumstances move us into different zones, but having an intentionality and a vision for kind of what I want my organization to look like and who I want to be in it, I think can go a long way to creating the organizational culture that does allow us to make meaning, to grow, and to be successful now and beyond, as we kind of determine where we're going to end up as this pandemic, we hope, draws to its conclusion. So on that note, we're going to head into our Q&A period of the presentation. Next slide. And while we take questions, we're going to go to the next slide, which is another resource slide. I just want to highlight that these are all hyperlinks to real resources that will give you more information on some of the topics we've covered. I want to point out there's a nice article called Internal Peer Support for Healthcare Professions During COVID-19. It's a nice article that can explain how to stand up a peer support program if you don't have one already. And then there's, of course, the other resources we've mentioned. So with that, I think Kayla and I will go back on camera and we'll open Q&A, and we will also see if any of our colleagues from OMH or New York or the Disaster Institute have anything that they'd like to add as well? So if you have, go ahead and type them.
Yeah, it's Kayla. I will jump in as usual. So yeah, if anyone has questions, please post them now. And definitely our partner, Steve Moskowitz at OMH, Tom Henry at DOH, if you have any questions or comments, that would be great as well. I have one comment and then one question, or one kind of elaboration. I'm just in thinking about the buddy system. Rachel, especially your point about having sort of two different buddies, one more on the mental health side, one more on the administrative or practical logistical side. That reminded me of a point that I always make when I'm teaching psychological first aid. And, you know, a huge focus of that is encouraging people to reach out to their sources of support, social support, kind of broadly defined. But here, I'll start my video as well. One of the things that we also like to elaborate on is recognizing that there are people in your lives who are good at different forms of social support. So there's some people you feel comfortable opening up to emotionally and turning to for that kind of need. There's other people who, you know, you don't want to do that, but they're great at practical support, instrumental support, things like that. So I could see that applying to the buddy system as well, thinking about who are you going to turn to for each of these kinds of assistance or guidance. And then my question is, you talked in the organizational stressors part about some of those issues around blurred boundaries and expectations being stressful for staff members. And I'm kind of wondering, this is maybe a more, I don't know, philosophical question, but how are we going to return, like now that we've kind of blurred those boundaries, opened up to each other, we've all seen each other's living rooms or home offices or kitchens or whatever, how do we kind of come back from that? And should we, like, what's that going to look like as a workforce moving forward?
I think it's an important and really good question, but I sort of stand on that and should we, right? Like there have to be ways for people that prefer or really need boundaries to reestablish those, and I think that's where the sort of organizational assessment comes in from a leadership perspective, but maybe also getting some assistance from folks that are more trained or informed in resilience or behavioral health to sort of say, okay, what does the staff really need here? But then I also think, and this came up in the chat quite a bit, there is something to be said about we've had to acknowledge that people are not just at work and can compartmentalize out the rest of their lives. Like they have multiple demands on them. So acknowledging that and then thinking about the workload or the way in which we work and how we support each other, I think leads to better practice and work process for me. It can be painful, right? I mean, it's a growing pain, but that's kind of how I think. And I think it's really about getting input from the staff in terms of what they need and understanding that kind of came up, that not everybody's going to feel exactly the same way. So how do we accommodate this in a way that's equitable and effective? Kayla, did you have anything you wanted to say on that?
Yeah, I would just add, like, really identifying what is sustainable and what is not when it comes to blurred boundaries, because there are positives that have come from that, Carla, as you mentioned, but also if we're looking at the impact of blurred boundaries on workload and level of effort, really having conversations with teams and at that leadership level of, is this sustainable? Or are we still kind of in that sprint phase as opposed to like a marathon mentality?
Steve or Tom, did you have any questions? And I see there's one that just came in.
I have an observation to share, which is many times a lot of managers always think that there's somebody else in the organization that's going to take the lead and is going to be the instigator and the initiator of some of these activities. And the one thing that came to mind with a lot of the things that you presented are that they are really simple. And virtually anyone at any level can take the initiative and introduce some of those activities or behaviors into their teams. And it's really a matter of doing it. And once you do, it's like that snowball going downhill. Success will breed on success and will encourage others to be aware that mood and attitude within the team is important, and that it can be affected by taking proactive steps.
Yeah, I agree, and I think keeping it simple, which is kind of how we ended, is important right now, because if people are fatigued and burned out or stretched, I have seen like leaders and well-intentioned leaders putting out these long emails with 25 resources and all this stuff, and it becomes yet another thing that is actually stressful as opposed to helpful. So keeping things really focused and simple, and encouraging the informal leaders, as you said, Steve, like you don't have to wait for someone with a title to do something. We know who the influencers are. I saw a question came up asking sort of how do we incorporate this kind of training, right, into other kinds of emergency planning. And I think I'd say there's many ways to do it. And one is to kind of identify what resonates the most and incorporate that into other kinds of team building or training exercises. It doesn't have to be 90 minutes. Certainly this is going to be taped. The last one was taped. So there's access to this kind of information that one could include with their own teams, but one could also adapt it and hone it to the specific workplace that they're in. And I just encourage people to do that. And I sort of ask people I get input from my actual organization, my team members, of what do they think this looks like for us? What do we need to train on, talk about, make sure that we're including in our policies that would be important. So it's kind of how I do it. But I'm also I would say Kayla and I are also extremely happy to talk to anybody offline. Our slides have our contact number. We would be happy for anybody to contact us if they just wanted to bounce ideas or had a request or needed a more clear direction towards a specific kind of resource based on what the interest is. And we're also looking for best practices still. So if, as we were talking, you were thinking, well, we do this really great thing that hasn't been mentioned, we'd love to hear about that and amplify that. And we'll give you credit for it, I promise.
All right, last chance for any final questions, and we'll wrap up a minute or two early. I'm sure no one will object to that. I'm seeing a lot of thank yous. That some of these are going to all panelists, but some are just coming to me. So great presentation, thanks for the info, all sorts of comments like that. So while people are posting their thanks, I will wrap up. So yeah, I mean, thank you so much to Rachel Kaul and Kayla Siviy for another very thoughtful and genuinely helpful training. I mean, that's always our goals in these webcasts, to give people not just the theoretical, but the actual applied tools that they can use. So I think you provided a wide range for people to choose from with that once again. So thank you for that. I want to thank Andrew O'Meara, the IDMH graduate assistant, for his technical support throughout. Thank you, Andrew, great job. And on behalf of my partners in this event, Tom Henry of Department of Health, Steve Moskowitz of Office of Mental Health, many thanks to all of you in the audience for everything that you have been doing to serve our community throughout the pandemic. We really hope this webcast has indeed given you some ideas for how to keep going. You know, we are hopefully moving towards the home stretch of this, but I think we are genuinely moving towards some brighter days. So let's keep ourselves resilient. Let's keep doing the good practices we know we need to do so we really can get to the end point together. And next year in person, all together, hopefully, let's shoot for that for sure. So thanks everyone, take care. Thank you, Rachel and Kayla. And I hope everyone does, be well, get your vaccines if you haven't yet, and we'll see you soon, I hope. Thanks all.